How you doing?
Fine.
Thanks, State your name for the record and who you representing.
I'm Dr. Scott Malone. I'm in San Antonio. I represent the orthodontist. I'm an orthodontist in San Antonio. I represent M&M Orthodontics and also Diana Malone. They're one in the same practice, but they're two separate cases from OIG against us. Right now, we've been under investigation from OIG now for 4 years with no resolution. Currently, we do not have a date for our overpayment hearing as of yet. Just to kind of, earlier we got into a little bit on the amount of cases and the extrapolation involved with that. In our particular case, on our M&M orthodontic case, from 54 patients, overpayment was calculated of $8.2 million with damages and penalties of $6.6 million. Again, that's about $15 million right there off of 54 patients. In our other case on Diana Malone, out of 40 patients, we have an overpayment calculated of $2.1 million and damages and penalties of $4.2 million. So the total on that is $23 million off of a total of, let's see, that's 90 patients. So where to begin? I know you've heard a lot already, so I'm going to try and skip through a lot of what everyone else has talked about, but really, from my perspective, I'll start from the initial investigation process. During that initial investigation, by the way, I am in favor of Bill 1536. It just is not, it needs to go a lot further than what it is. During an initial investigation, like you had heard earlier in some of the other offices, you pretty much shut down your practice for 3 days. You know, in our particular case, we have 8 doctors and we had just over 100 staff members. So we shut down, we accumulate all the records. What happens from this process is you're already labeled as a fraud provider. So your staff is looking at you, you know, maybe someone who's only been with you for less than a year, and you also have doctors who don't want to be involved with that. So immediately upon investigation, you have some doctors leaving and a lot of your staff leaving, and at that point your referrals around the community start drying up because these staff members, you know, they're all very small. Dental communities, a very small community. You become labeled as the fraud guy, and then all of a sudden, you know, you don't have any way to support yourself. Your referrals have dried up. That's been, you know, there's not a whole lot of you can do about that because an investigation is an investigation. I understand that. I'd like to talk a little bit more about the CAF holds, the credible allegation of fraud holds that they come up with. Immediately once you get on a CAF hold, you're going out of business. There's no ifs, ands, or buts about it. Your life has just changed. In our particular case, we're 60 to 70% Medicaid. You know, we came in, we've been on a CAF hold now for over 2 years. And, you know, with no end in sight. So all the funds were being withheld from us. The way they go about putting on a CAF hold on the practices are they, out of 10,000 patients that we had, they come in and audit maybe 200 pre-selected charts. Out of that 200 charts, it gets whittled down to about 70, and in our case, whittled down to about 50 some odd charts. They hire an expert to take a look at this to determine whether or not to put you on a CAF hold. In our particular case, like in many others, their expert who looked at our case had never seen a Medicaid scoring before, had never scored a Medicaid chart, and based on his you know, interpretation on how the scoring should go, we got placed on a CAF hold, and essentially all of our funds are dried up. I have 10,000 patients that I'm responsible for seeing. I have 8 doctors I need to pay and 100 staff members I need to pay with no funds in sight. In our particular case, we went to our personal savings. For the next 8 months, we continued to see our patients. We continued to pay all of our staff and all of our doctors. At that point, OIG has gone through additional measures to disable our practice. One I think you heard about earlier, and that's the negative publicity. We had that in our area done as well. But in addition to that, it came time for us to renew our provider status as being a Medicaid provider. So when we turned in our application to be to renew our application to be a provider, that was denied. TMHP is in charge of approving or denying that. I have a letter, you know, and what happened was OIG instructed TMHP to deny our request because our charts are under investigation. So here I have 10,000 patients, I have no funding, and now I'm not a Medicaid provider either. What am I supposed to do with my patients? So, you know, these are different ways that they go about trying to disable the practice. You know, other things that just kind of miscellaneously come up. Most of the providers here, I haven't talked to all of them, but we're covered under malpractice insurance from American Association of Orthodontists. That's the biggest provider of malpractice insurance for orthodontists. We get a letter from AAO, American Association of Orthodontists, taking away our malpractice insurance and dropping us because of the ongoing investigations with orthodontics and Medicaid in Texas. Let's talk a little bit about some of the retaliation and some of the things that are going on. You know, our case has gone, you know, pretty far down the pike now. I still don't have a date on my overpayment hearing. The extrapolation that we talked about quite a bit, you know, that was our case that we were talking about. One of our cases, the extrapolation was looked at. It was determined that it was a faulty method for extrapolation. Not only did they extrapolate faulty, but the underlying program that they use is a faulty method. And that hasn't been proven. It's been, you know, from our side, it's been proven. We just haven't gotten it into the court system yet. But on that extrapolation, he had mentioned that they dismissed that once they found out that there was faulty. They didn't dismiss that. The judge dismissed it with a summary judgment. As soon as that was dismissed, 2 weeks later, same dates, 2 more cases opened up against us. One against Diana Malone, one against M&M Orthodontics in retaliation for, you know, a favorable ruling. So, you know, you can see kind of what's going on here. We also have different stalling techniques that are going on. Again, I've been investigated now for 4 years with no resolution. Some of the I was supposed to be yesterday was supposed to be the date for my overpayment hearing. 2 weeks ago, we had an initial expert. They introduced a brand new expert that went through all of our cases again, using, again, taxpayer dollars, you know, going through all of our cases again. So now we have 2 experts from OIG that, you know, of course, we're going to have to depose their experts and go through the whole process again. But here we go. We're getting to, you know, postponed and postponed and postponed again. Coincidentally, you know, we get back to the HLD index, what the stem of all this was. You know, when all this came up a couple of years ago, the HLD index was the brunt of it and the stem of the whole thing. Well, there's documentation that, you know, it was said that, well, you know, maybe a patient calls in, maybe another doctor calls in with a complaint. That's not what happened. The top 20 providers were automatically investigated, and we were one of those top 20 providers based on nothing other than how much, you know, how much we're billing. And but anyway, on the HLD issue, their own experts, the 2 experts that they have, didn't agree, I don't think, on one of our charts. I mean, there's just across the board on what their own experts disagree with. So, you know, it's been a travesty. You know, our practice is ruined. I will never be a Medicaid provider again, you know, but what we're trying to do is make this better for the future. 1536 makes a step in the right direction, but it really needs to go back to the cap hold, because even if Bill 1536 goes through, that's dealing with the overpayment hearing. You know, if you owe $23 million, that may make you or break you. You're getting into at least a jury trial over the overpayment. But my practice is already ruined years ago. So if you want, you know, if you want a provider's bill of rights, or you want, you know, justice in it, we need to go back to the payment hold. That's what's unconstitutional out of this whole deal. It has nothing to do with the overpayment hearing, because we will get to justice at some point there, but that's after the fact. You know, we're ruined now.
You brought up an interesting point regarding insurance in all of this. You know, you said you represent a professional organization as well, correct?
It's our company. Yes.
Oh, just your company. Yes. But what's been your? I mean, do orthodontists in the state of Texas that take Medicaid have a significant, or do you have to pay a significantly higher amount of insurance because you take Medicaid and run the risk of fraud claims?
No, we don't pay more. We just got dropped from the insurance that we do have. What happens, you know, they'll come up with numbers that we have this many providers. I did my training in San Antonio, and our program there accepted Medicaid. During that training program, each resident was not allowed to take more than 5 Medicaid cases because it was a self-sustaining program. In general, Medicaid fees are about half of what a normal fee are, so they wouldn't allow you because we couldn't run a program on Medicaid fees. So you're allowed 5. That's a good example. The university was accepting Medicaid, but 5 cases. And many providers want to do good for the community, so they take a couple cases. And that's how you get the larger providers, or, no one's accepting. In the San Antonio area where we were, we had 6 offices in San Antonio alone. No one else was a provider. We used to be one of the largest providers for foster care around the state. We used to be one of the largest providers of the handicapped kids. We had children that were referred to us from Santa Rosa as well as the University Hospital because they already met their quota on how many Medicaid patients they would accept. They didn't accept anymore. They would affirm to us and we would take them. All that's gone. They took away our ability to be a Medicaid provider as well as this ongoing fiasco.